slow and steady. That was Kieran Moore's words, basically. And here again, perhaps we need just a little bit more time. Few days from now, we might be able to tell, the impact of different strategies then. Right now, we should enjoy the good news. We're probably about to have a high plateau for hospital occupancy.
The head of Ontario's COVID-19 Science Advisory Table tells CP24 he believes our province will see a peak in hospital occupancy this week as we try to get through this Omicron wave. And as the Ford government consistently announces funding for more hospital beds, frontline workers continue to flag staffing shortages that will make any new bed impossible to use to save a life. ICU doctors are now tweeting examples of how beds available on paper cannot be used in reality because our hospitals simply do not have enough staff, going so far as to say, I don't understand why the Ontario government misinforms the public about operational ICU capacity.
And just 2 weeks ago, the Registered Nurses Association of Ontario issued an open letter to Premier Doug Ford that reads in part, throughout the entire course of this pandemic, you have continually shown disrespect for nurses and the nursing profession, turning a pre-pandemic nursing shortage into a full-blown nursing crisis. To discuss, we welcome back to CP24 tonight the Director of Critical Care at Michael Garron Hospital, Dr. Michael Warner, and the CEO of the Registered Nurses Association of Ontario, Doris Grinspan. We appreciate both of you making time for the program. Dr. Warner, can you explain to viewers why all beds, even the ones that are now funded by the Ford government, aren't usable beds right now?
Happy to, Reshmi. So here are what the numbers actually mean. So today in Ontario, there are 1,850 critically ill patients in the ICU, total, COVID and non-COVID. On paper, Minister Elliott says we have 2,343 beds, so allegedly 493 empty beds. She also says that we can add another 500 beds on top of that. At our peak of wave 3, the worst day on April 30th, we had 2,033 patients in Ontario's ICUs and 891 of them had COVID. It is impossible to staff 2,343. It's also impossible to staff 3,000 beds. A bed without a nurse, without allied health, without a patient care assistant is just furniture, and the government knows that. And it's really insulting to people who are working in the hospital because, that information that the minister shares gets shared on mainstream media, on social media, and it gives people the impression that we're sitting around with empty beds with lots of staff to take care of people. We don't want to cause people to be concerned unnecessarily, but you have to tell the truth. And what they're saying isn't the truth.
So, Dr. Warner, should we stop using beds as a metric for hospital capacity? Should we shift the conversation to staff?
Of course, because, unless you can take care of yourself in an ICU bed, that is useless. It's pointless. It's nice that they funded the beds on paper. I'll just give you a concrete example. So today, there's a hospital in the GTA that's moving 4 COVID ICU patients to other hospitals, 4. On paper, they have 20 empty beds, okay? So they're not telling people the truth, and it's just really frustrating. And I think if people knew the truth, then they would stop chirping doctors and nurses on social media, and the government would be straight with people. And that's just what I'm asking for.
And I can imagine that it would lead to confusion, too, when hospitals are trying to communicate with each other in trying to identify who has an available bed for someone who needs life-saving measures. Doris, is there anything from the Ford government that you've heard that is promising in addressing this in a realistic way?
Well, I guess the Premier is helping people get off the snow. Maybe that's the approach for distraction. But as it concerns nurses, many of whom walked 2 hours to be with their patients yesterday and stay as likely as Dr. Warner knows for 30 hours to work. They have given it all. They have given it all to a government that completely disrespects their work, that continues to insist on Bill 124, and that knows that RNs are leaving, including to Edmonton, including to agency work, including to the US, and the government sitting idle. Instead, I don't know if you saw this memo, Reshmi, but now they're bringing to the nursing homes in temporary basis internationally educated nurses. They should repeal Bill 124, improve the conditions of nurses so they can provide the care they want to provide and they have some level of job satisfaction instead of drive-through nursing. and they should fast track the internationally educated nurses. Reshmi, and I don't know if Dr. Warner knows, 21,000. Last week I told you 15,000, 21,000 internationally educated RNs and RPNs in this province, waiting, some of them for 10 years to be processed. It's a disgrace, and the government is aware of it. One more reason that they're doing nothing. Nothing. They are causing a system collapse that is preventable, that is absolutely essential for the public. And the question is why they're choosing to do that. What's the real agenda of the fourth government?
So, Doris, a lot of the solutions that you're presenting might take time to put into action. What can be done right now, do you think? I mean, could the military step in to help staff those beds?
Reshmi, nothing will help. There are things that they can do immediately. Repeal Bill 124, which doctors are not on it, which police and firefighters are not on it, thankfully. That should have been done March 11, 2020. 2020. We are in 2022, 2 years into the pandemic, and Doug Ford and the Minister of Finance dug their heel continuously to continue. That's what they should do. To fast track the IENs, they can do it as we speak. There are solutions. They don't want to put them on the table, and the public should know about that.
Dr. Warner, are we hearing enough advocacy for nurses, for the people that we need in the ICU to keep people alive?
Well, just to reflect back on what Dr. Grinspan said, there was a snowstorm the other day, and I guess we're still in it, and the nurses on night shift, they stayed in the hospital. They slept in the hospital so they could be available for the next night shift. I mean, people talk about the healthcare system being broken, but it's not because of the people who work within it. I think the government free rides on the goodwill of nurses, and other people get much less attention than doctors because these people are incredibly dedicated. And believe me, when you're sick, you're going to want them by your side. So, I'm not going to wade into the politics of this, but I've never understood why my critical care nursing colleagues don't get any type of, payment bonus for the extra education they have or for the danger they subject themselves to. They work incredibly hard, and they need to be respected, whether that's financially or otherwise. And, I think that the crisis in healthcare preceded COVID, and it's going to be hard for any government to fix an airplane while it's flying, but you definitely need to invest. And that's, if you're going to invest, that means you may have to raise taxes, et cetera. I mean, you can't have everything both ways. And the other thing I just want to say is, if we truly had this many ICU beds available to us, then why are we canceling surgeries? That's the part that I hope someone asks the Minister of Health, because you cannot have that both ways either. Canceling surgeries and have allegedly empty ICU beds, because if they were empty, they'd be used.
Yeah, that makes sense. Dr. Warner also talked to us about the trickle-down effect of this whole issue with staffing. I mean, do all problems just lead back to staffing? When we think about all the paramedics that are waiting outside hospitals for those patients to be admitted because they don't have a nurse that can attend to those patients on the bed that is available?
It's a fully integrated system, and that's why people who aren't working in healthcare seem to be so fussed about incidental COVID. Let me tell you how an incidental COVID patient gets treated. The same way as someone with non-incidental COVID. They're in the same rooms, on the same wards. The same barriers to discharge exist because they can't get home care. It's very difficult to get them back to long-term care. So the whole system gets paralyzed. That's part of the supply-demand problem we're having in healthcare. Vaccine mandates, at least in my institution, have not been a problem. People say that's the reason why you don't have nurses. We've lost less than one full-time equivalent in our ICU. I think that a lot of this preceded COVID, Omicron, with missing healthcare workers because they're sick or isolating has not helped, and that will get better. But there's systemic issues that need to be fixed. Investment is necessary. But I think in the meantime, just being honest with the public about the resources we have so the people who work within the system don't feel the need to come on television to tell the truth.
Reshmi, to add to the Dr. Warner said, and yes, I do weigh into politics because actually policy is led by the politicians that are at the helm. You remember that the Premier used to talk with me a lot, right? You know when he stopped to talk with me? He has not called even once since I started to talk about Bill 124. The Premier is riding on ideology, but the public is actually suffering the consequences. When we are in a pandemic, ideology at all times, but especially in a pandemic, ideology should be swept aside, like the shovel he used yesterday, and he should move with the strategies that he knows will retain nurses here. And we are not the union. The union will negotiate the benefits and all of that after Bill 124. But I am telling you, because we have a very close hand in the pulse because of the surveys, that Bill 124 is the key reason why nurses are leaving to Edmonton, to other parts of Alberta, to the US, to agency work where they get 3 times the money. So the hospitals are paying the money anyways. They're just paying it in ways that is not the best for patients.
Mm-hmm. And I also want to get to this issue of the data that's being reported by the Ford government, because when we see these ICU occupancy rates, we're now being told which ones are fully vaccinated and which ones aren't. But now we know that COVID-19 takes 3 doses to be fully vaccinated. Dr. Warner?
Sure, I'll walk you through that. So I've cared for over 200 COVID patients in the last 2 years. I've only had one patient who's had 3 shots in my ICU, and that particular patient was post-organ transplant. The government presents data as fully vaccinated, partially vaccinated being 1 shot, or unvaccinated, and they consider fully vaccinated 2 shots. This is a 3-shot disease. If you want the public to get vaccinated, you need to emphasize how amazing the vaccines are at preventing severe disease. Instead, Minister Elliott tells you how many fully vaccinated people are in the ICU, but they've only had 2 shots. Break it down: 3 shots, 2 shots, 1 shot, 0 shots. That will help with vaccine hesitancy, and will also take a pillar away from the anti-vaccination people in this world, because they will look at the fully vaccinated people in ICU and say, I told you so, the vaccine doesn't work, but the vaccine works, especially if you get 3 shots.
Yeah, it feels like an uphill battle.
The vaccine works also, Rashmi, on the healthcare professionals that provide the work, and for them to protect themselves, to be at work, and also protect their patients. And I concur with Dr. Warner. I don't know of a handful of nurses that really have left because of the vaccine. The great majority is because they cannot provide safe and quality care because of the workloads, and the workloads are related, of course, to the issue of Bill 124, and it's a bad cycle that keeps going aside, except that nurses, more and more are leaving this province or leaving the hospitals to go to agency work. It's a tragedy. And no, it has not been always this way. Yes, it preceded the pandemic, but it actually was absolutely catapulted into a full-blown crisis under the situation, both of a pandemic that is very lengthy, but also a bill that absolutely needed to be repealed, and the Premier is, for ideological reasons, refusing to do that.
Well, let's hope he returns your call, Doris. We do appreciate both of you making time for us and responding to our calls. Let's hope that the Premier answers Doris Grinzman's calls. It's a necessary conversation. We appreciate both of you making time to have it with us on CP24 tonight.
Thank you.
Thank you.